LJ media, and during that inoculation, or you inoculate into any of the enriched broth, and then you can go for all biochemical tests even before the colony formation. If you are ending up with all the but even in the enriched growth, at least it takes at least minimum time. It takes minimum if it is 2 weeks or 2 to 3 weeks in a solid media, it might multiply within a week in a liquid media. So you can perform all the biochemical tests and you can confirm if at all they show positive for all the 7 biochemical tests, then it is Mycobacterium tuberculosis. So what are the things? Can you repeat all those things? Number one is niacin test. Niacin is actually niacin statin is said to be an antibiotic. So niacin test. Number two is aryl sulfatase test. That's an enzyme test. Number three is catalase peroxidase. That is also an enzyme. Degradation of the reactive oxygen intermediates, and neutral red test, decoloration of neutral red. Then pyrazinamidase test. Then what is it? Tweenate hydrolysis, and the last one is nitrate reduction test positive. You're getting me? Right. So coming to the thermal death point, so that those are the biochemical, that's cultivation, a thermal death point. Normally, if a person infected with the Mycobacterium tuberculosis, he spits his sputum somewhere outside. We have to finish this 9:53. Okay, so if he spits the sputum, the bacteria can remain alive for 20 to 30 hours in the sputum. For 20 to 30 hours in sputum, on sputum. Suppose you have touched sputum unknowingly, that means highly contagious. But probably that might be possible only in Bangalore. Suppose if he spits somewhere in Tamil Nadu, or if he spits somewhere in Andhra or Kerala during summertime, because this bacteria is very much sensitive to light and UV rays, sunlight and UV rays. Suppose the sputum is exposed to sunlight, direct sunlight, for at least 1 hour, even 20 minutes, 20 minutes to direct sunlight and UV rays, probably they will not survive. So they are very much sensitive to sunlight and UV rays. So inside the tissue, they are very active. When it comes out in the form of phlegm or sputum, normally they cannot tolerate the sunlight and UV rays. Maximum to 60 degrees centigrade also, they'll not be able to. So suppose if you are taking, that's what we say pasteurization. Pasteurization is boiling milk. Mycobacterium bovis can be inactivated or killed. It is actually said to be a not sterilization process. It is actually said to be a disinfection process. Disinfection says you heat the bacteria, say above 60 degrees centigrade, probably most of these organisms are sensitive to heat, they might die. So if at all any udder infection, whenever you milk the cow, you have got Mycobacterium bovis in milk. If you drink milk, raw milk, probably you will get that Mycobacterium bovis inside your body. If you are going to heat it, boil it, not boiling actually, heating it at more than 60 to 70 degrees centigrade, then probably you can eradicate this particular bacteria. Okay, but it can stay in a droplet or aerosol for 7 to 10 days, active in a droplet. Since because I told you this has got most of the characteristics of fungus. A drop of moisture is enough for them to survive for 7 to 10 days. See how vigorous this organism. Someone sneezes with the tuberculosis, and that will remain in droplet for 7 to 10 days, and someone inhales, probably they'll be infected. So main type of infection is aerosol infection only aerosol infection. But these organisms are resistant to some of the chemicals, even though they are very sensitive to sunlight and UV rays. They are resistant to certain chemicals, especially 5% phenol. I told you, carbolic acid, any carbolic acid, in other words, we can speak about, not specifically phenol, 5% carbolic acid, any carbolic acid. Then they can withstand 15% sulfuric acid. You use 15% H2SO4, they can survive. And they can also withstand alkali also, 4% NaOH, sodium hydroxide. Some of the organisms will not be able to survive under alkaline condition, but they can survive 4% NaOH as well. So highly resistant organisms. Okay. Now coming to the antigenicity, we'll finish off this antigenicity at least so that we'll go for diagnosis and treatment next class. I'm not going to explain more about the disease module, how the disease has been. The disease actually it's been categorized into two types as exudative type and productive type. Mycobacterium tuberculosis, as I told you, it's called as AIR. What is AIR? Acute inflammatory respiratory disorder, and it causes pulmonary and extrapulmonary diseases. It causes both. What is pulmonary? Related to lungs. Pulmonary infections means related to lungs, pleural membrane, alveoli, bronchi, everything inside lungs. And extrapulmonary, outside lungs also, they can cause a lot of diseases. Mycobacterium tuberculosis can end up with a bone infection also. They can go with the different places in different areas in the body, and they can cause disease. There are two types of disease. I'm not going to explain this. There is a video given in the LMS. You can go through the video. A complete pathogenesis being given. I don't want to take much time because I have to finish it. Whether you are reading all these things, LMS content, whatever that is being posted, we attempted all the challenge questions, what has been given, all easy questions only. I don't know how many of you are doing it. They are taking a record of it. If you are not seeing it, probably you will be noted down. So please, whenever you find time, whenever you are feeling bored, please open the LMS and see medical microbiology. It's not going to be very hectic. You can compare it with my notes also. Probably that is been taken from a text. Whatever that I am taking, speaking is out of my studies and out of my, whatever the books I swallowed, I'm telling you. So that will be different and this will be different. So have that difference between those two and go through that text as well. I've given you two videos, especially for tuberculosis. One about pathogenesis, the other one. Pathogenesis is very important, just note down, because that's, I told you, it's a 5-mark question. Pathogenesis of tuberculosis bacilli. The disease alone I'll explain. There are two types of disease. One is called as productive disease. The other one is called as exudative disease. Exudative disease means, you know that exudative, something will come out, ooze out from the lungs. And that makes the lungs very soft. It's called soft lung disease. Exudative disease is called a soft lung disease. Whereas productive disease, it becomes more calcareous. Calcareous in the sense calcification of lungs, hard lungs, calcification of lungs because of the formation of tubercles. Calcification of lungs will be there, and it becomes very hard lung disease. Because of hard lung disease, what is the main issue? You'll not be able to breathe, but because actually it works based on the balloon. Probably you know that lungs works based on the balloon, inhalation and exhalation, inspiration and expiration. So you taking in oxygen and breathing out carbon dioxide. So it has to squeeze in and squeeze out. So if it is becoming more harder, so people will not be able to breathe. That will called asphyxia. So that is called as the difficulty in breathing. So both of these diseases, exudative and productive diseases, cause acute inflammatory respiratory disorder. I'll just give you the term alone, please note down. If it is exudative, it is outpouring of fibrinoid inflammatory exudative fluid. Nice, no? Outpouring means coming out. Outpouring of fibrinoid. Fibrinoid means whatever that is being present in the tissue. Fibrinoid, inflammatory, inflamed tissue. Inflamed tissue, some exudates is coming, just like edema we speak about. Outpouring of fibrinoid inflammatory exudative fluid from the lungs. From the lungs. Rich in polymorphonuclear leukocytes. What is it? Of course, phagocytes. Rich in phagocytes. Sometimes monocytes also. Some monocytes means macrophages. Very rich in PMN, sometimes with more amount of monocytes. Monocytes here we refer to macrophage. Again, it's a phagocytic cell. Okay, so that's said to be soft tissue disease. Soft tissue disease because it is pouring. Something is coming out from that. Now, what is productive? The T lymphocytes, you know what T lymphocytes? The T lymphocytes attract all the macrophages. T lymphocytes attract the macrophages and causes a granuloma formation. Causes a granuloma formation. Granuloma formation. So because of the granuloma formation, there is a formation of tubercle. Tubercle means just like nodules inside the lungs. Tubercle, formation of tubercle in the lungs, which leads to peripheral fibrous tissue. Which leads to peripheral fibrous tissue around the granuloma. Peripheral fibrous tissue-like layer around the granuloma, and calcification, followed by calcification, followed by calcification. We call it as hard lung disease. Hard lung disease. Okay. So whenever they enter into the nostrils, whenever the aerosols enter into the body, it goes directly into the upper respiratory tract and flows to the lower respiratory tract, reaches the bronchi, alveoli, and goes to the lungs, and they cause these two diseases. They survive in the lungs and they can cause this two disease. Okay. So
Sir,
other,
excuse me,
yes,
sir.
yes, yes.
Sir, about this productive disease, can you just repeat that sentence what you said?
What are the things? T lymphocytes. Uh, what I told you. T lymphocytes attract the macrophages to the site of infection, followed by the formation of a granuloma and tubercle formation inside the lungs. And after that, the granuloma is being surrounded by a peripheral fibrous tissue. Peripheral formation of peripheral fibrous tissue around granuloma, followed by calcification, followed by calcification, leads to hardness of lungs.